Well, each and every Friday, Dave, we've been blessed to be joined by Dr. Richard Pan. He gives us incredible insight, incredible information. We encourage you to text in questions for him, as we welcome in the doctor. Dr. Richard Pan joining us here this morning on The Drive. Doctor, how are you this morning?
I'm doing all right. Good to be with you again.
Well, we appreciate this. We can't tell you how much feedback we get on when you come on with us, so you really are helping us, helping the community, and we thank you for that. And kind of our first question, we always kind of lean on this first, but where are we today, I guess, in relation to last Friday, the Friday before, and kind of where do you see us going?
Well, we are seeing a pickup in the number of cases and people coming to the hospital. As I think I mentioned before, we are behind in testing, but we are greatly expanding testing. So some of the increase in cases is because we are testing more. That's a good thing. But also it is spreading in our community. But I would also say that if you look at what's happened here in California and here in Sacramento and compare it to what's happening in the rest of the country, our work together trying to slow the spread of this disease is working. We are slowing it, but as I said, slowing it, so it's still spreading. So over the next couple of weeks, we will continue to see cases rise, and we're seeing it more in sort of Southern California, LA right now in our state. Up here in Sacramento, not as much, but we are still seeing it spread. So we need to be sure we persist and continue to stay apart from each other physically. I said physical distancing. That's 6 feet away, washing our hands frequently, trying not to touch our face, not being sure we're not gathering together in groups, and we just got to keep working at it.
Dr. Pan, I want to start with a question from the audience here, and I think it's a good question. Now, we've been reading about how smokers and vapors could have far more difficulties or more difficulties with this because of lung issues, but one thing I haven't heard asked, you saw Dr. Fauci talking and a lot of conversation about 6 feet apart, sneezing, coughing, the virus being able to spread that way. But has there been any study as to whether or not when, for example, a smoker or a vapor who, let's say, is infected with COVID-19 blows out their smoke and or vape smoke, has there been any studies as to whether or not that process could, in fact, carry the virus maybe even further than 6 feet because of those vapors?
I am not aware of any studies that address that. That doesn't mean that there might not be one out there. I have not run across it. But what we do know is that it seems like that this virus is transmitted through droplets, which then if you cough or sneeze into your hand, which we tell people not to do in the crook of your elbow, then can be transmitted when people touch things, or just when people cough and sneeze and the droplets fall to wherever they fall. So that's why the big emphasis on washing our hands, because as we touch things, it's not that the virus infects us through our hands, it's our hands touching our face. That's the other part. Please try to avoid touching your face. So that's your eyes, your nose, your mouth, because that's how the virus gets entry. And so that's what we need to continue to do, be very conscious of that. For people who smoke or vape, the challenge is that this is a disease that affects the lungs, right? So that's why people end up on ventilators, and that's generally how people end up dying of the disease, as well as I understand kidney failure is also apparently a part of what also gets people in trouble if this disease gets very severe. But people who smoke or vape, they do have more inflammation in their lungs, and so they are more vulnerable to this kind of infection.
We've heard, as Dr. Richard Pan joining us, Doctor, we've heard more and more talk lately about masks or anything, even a bandana or something to cover your nose and mouth if you are out and about. What would you say about that? How vital is that if someone were to be doing something deemed essential, or making a trip to the store or something like that?
Sure. Well, we talked about masks 2 weeks ago, and then the recommendation was that people shouldn't be wearing masks in public, mainly because we need to be sure the masks are available for the medical people so that we don't use up the supply. And so some things have not changed and some things have changed. So first of all, I would point out that the masks are not about protecting yourself. It's about not spreading it to other people. And as we have identified that many people actually are infected who don't have any symptoms. And so there's concern that people who are asymptomatic, meaning no symptoms, who are infected, they could still potentially transmit the disease by breathing. They're probably not coughing as much, but through breathing or other mechanisms actually spreading the disease. And so the hope is by asking people to wear some kind of covering over their mouth. And they're still not recommending surgical masks because we still need to save them for the medical personnel who are in a situation where they're intensively in the middle of people who have the disease. So, again, it's to prevent them from spreading it to people who are very vulnerable. But to have a covering to try to limit the spread of the virus from anyone who might be infected. So that is the current discussion. There's a lot of mixed evidence about how effective that really is, but I think that is an approach that people are discussing. Now, one thing I do want to really emphasize is that everyone who talks about whether we should all wear masks or not all wear masks, the experts, they all agree that the most important thing people still need to do, even if you wear a mask, is to wash your hands and not touch your face. And in fact, sometimes when people wear something around their face, they may be more likely to touch their face because they're moving it around or so forth. And so you need to try to constantly remind yourself to wash your hands so you don't get the virus on your hands, and then touch your face, which means your eyes, your nose, and your mouth. And so wearing a facial covering might be able to help limit the spread of the disease, because in case you are infected and you just don't know it, that might decrease your capacity to spread it. But we still also remind people that the social distancing, the hand washing, the not touching your face is actually the most important thing for people to do.
I want to do a quick follow-up. Sorry, Dave. Just a quick follow-up on the hand washing. I think people are doing it. I think people are being diligent. Is there a recommendation for, you've sanitized, you've washed your hands. How often should you be doing that if you don't feel like you've been anywhere or touched other things that you might be vulnerable to? Is there a general guideline of how often someone should be washing their hands?
Well, it really is about being in places. What happens is that when you touch something and the virus is there, so a door handle or something like that, then you bring your hands to your face, and that's how you can potentially transmit the virus. So in terms of how often you wash your hands, certainly any time you are outside your household and where other people may be around, where they might have actually breathed on, coughed on, sneezed on something, your hands touch something like that, then they could be contaminated with the virus, and you need to wash your hands. So it's really about washing your hands before you touch your face, and that's one of the most important things. A lot of us touch our face without thinking about it, so sometimes people talk about training yourself not to touch your face. Keep your hands below the level of your head. If you feel like you need to touch your face, like your nose itches, wash your hands first, right, so that your hands are clean. If you choose to wear a mask or a covering over your face, one of the things people also need to remember to do is you need to wash your hands first with soap and water before you put the covering on your face, so you don't actually contaminate the covering, right? So if you're putting on a mask, you want to be sure your mask isn't contaminated as you put it on. And the best way to contaminate that mask is actually if your hands were not washed and they may be carrying the virus. And then when you take that mask off, you then also need to wash your hands afterwards, because in case your mask is contaminated by yourself, because then you don't transmit it to other people. So you have to think of your hands as something that could carry the virus, right? And you want to avoid having those hands transmit the virus either to your face or from your face, in case you're someone who's infected and just not symptomatic, to other things.
Dr. Richard Pan with us. And Doc, normally I might not ask you this question because we're sticking just straight to medicine, but I think you're uniquely qualified both as a doctor and as a state senator to weigh in on this. You I'm sure, saw the report yesterday from the Sacramento Church, the one in Rancho Cordova, 71 infected with coronavirus. We see Dr. Fauci shaking his head, wondering why there are still 11 states out there that do not have statewide stay-at-home orders. Do you think ultimately let's just stick to California, are doing enough to flatten this curve when it comes to basketball being played at the park, to gatherings in homes, or would you like to see on a statewide level more enforcement and stricter guidelines, if you will, to try to save these lives? Where do you fall in there?
Well, ultimately, it's about having as many people as possible follow the guidelines about staying at home, not going to gatherings. And I would point out that we don't have enough police and National Guard in the state to make everyone do that if people aren't willing to do it themselves. Now, we probably should think about selective enforcement. What I mean by that is that people who persist despite warnings and they're having large gatherings or calling for large gatherings, there should be some consequences to that. But ultimately, it really is about each one of us recognizing that we are the front line against this virus. We don't have a treatment. We don't have a vaccine. It is all of us together doing our part to try to slow the spread of this disease, which means staying home as much as possible, right? I know we have to go out and buy groceries and do other errands. When we're out there trying to stay 6 feet away, you can go outside, but keep your distance from people, right? And then doing what you can to prevent the spread of the disease, like washing your hands frequently, like we talked about, recognizing that trying not to touch your face so you're not either infecting yourself or infecting other people. Obviously, you're living with people in your household, but you don't need to be gathering or doing play dates or meeting up at the playground, or we know here in Sacramento County, unfortunately, it seems like places of worship have been a place where the disease has been transmitted. I know that many pastors and ministers are doing virtual services. We certainly want people to follow their faith, but we need to do it in a way that's safe, that doesn't spread this disease. They do say God helps those who help themselves. So let's all work together and do everything we can to slow the spread of this disease and be responsible both for ourselves and for other people in doing that.
Doc, I want to follow up there because you said the magic word, which is vaccine, and I'm going to do a build-up here for a second, because for those who aren't familiar with Dr. Pan, and listeners, a lot of them will know, he became a hero to me in his continued fight in education and enforcement of making sure that our eligible children are vaccinated and lessening the spread of so many things in our communities. And Dr. Pan has had all kinds of harassment, both personal and all kinds of things he's gone through to, in my opinion, save quite a few lives. I want to put that as the disclaimer, because when you talk about vaccination, what we're hearing is we're maybe 18 months minimum away, and then you hear experts saying that's not enough because you have to do trials. You have to make sure that these vaccinations are safe. So I think you're the perfect person to ask here. We're in this point where we want the vaccination as quick as possible, but at the same time, you've dealt with the anti-vaxxers so much in your life. Is there a possibility that down the road they may really for the first time have a point if they come out and say, hold on a second, I understand the need to vaccinate here for COVID, but we don't know what the long-term effects are? Where do you end up citing yourself on that argument?
Well, first of all, I want to point out that a vaccine should not be approved unless it's already been demonstrated to be safe and effective, and that is what we've done in this country. So all the vaccines that are approved have gone through rigorous clinical trials, and same with whatever COVID vaccine that may eventually come out as well, which is part of the reason why it's going to be at least, and I said at least 18 months before we have a vaccine against this virus, because how are we going to know that it's effective? Well, someone's going to, you're going to have the study subjects are going to receive the vaccine, and we're going to follow them. And unfortunately, we can't speed up that time, right? So we're going to follow them and see what happens, right? We will follow them to see what kind of side effects may happen, although those tend to happen more quickly. But we also need to follow them to be sure that the vaccine still works, right? If you receive a vaccine, you want to know that the vaccination is actually still protecting you, and for how long does it protect you, right? And so that just takes time because you have to wait and monitor and study this, and that's why even though you're hearing about all these vaccines people are inventing right now, and it's a marvel of modern medicine that we've been able to already gene sequence this virus. We are looking at candidates for treatment based on that gene sequencing, and these are things that have happened remarkably fast. And then we've also, multiple companies have talked about vaccines they're developing, but in order to demonstrate that they are safe and effective, it's going to take a minimum of 18 months. And that's why I say 18 months is if everything goes right. So you think about all the different vaccines people have developed for a variety of different things, and we're going to see the same with COVID. Most of them will not meet that standard, and they will never see the light of day in terms of beyond their initial studies, and that will be it. And basically they'll be shelved. So any vaccine that comes out needs to be proven to be safe and effective before it gets recommended for the general public, and that's why it's going to take a minimum of 18 months and probably longer before we get one.
Dr. Richard Pan with us. Doctor, I've seen a lot of things about, what's the term, viral load or viral dosage that people might be passing along. Is there any correlation into the different levels of people getting sick? A lot of it we've talked about, well, it's maybe health circumstances or age, even though that's not foolproof. Is it more related to the actual dosage of this viral load that people are getting sick from? Is there any correlation there? Or are some symptoms, or some of those loads less? Is that why some people are coming through? Is there any answer to that?
So the viral load is how much virus is in you. But don't forget the virus replicates. That's how viruses spread, right? So it doesn't take a lot of the virus to necessarily infect someone and then spread. And, of course, how vulnerable a person is to the virus may affect how much virus they need to have been exposed to before they themselves get sick. So viral load probably more describes a person who's infected, how much virus is in them, and then that they might be transmitting to other people. So someone with a high viral load is presumed to be potentially more infectious. It doesn't necessarily mean they're more symptomatic. That has to do more with their own condition and vulnerability. Although certainly a person with a decreased immune system probably more likely to have a higher viral load. And then how much of the virus do you need to be exposed to actually get sick? We're still trying to figure out, but it's a virus, so it may not take that much for someone to get infected with this virus. So we're still trying to figure some of these things out, but clearly what we do know is this is a very infectious virus. It's more infectious than flu. So far, it seems like approximately for every person who gets sick, they tend to transmit it to at least 2 other people, which is part of the reason we see this exponential rise in the number of cases that we're seeing around the world. And we need to work very hard to be sure we slow this down. And how do we keep from infecting 2 other people? Well, if you stay away from other people, then it's not going to be able to get to them.
Dr. Pan, guessing is probably not a great thing here, but nobody's guess is going to be more educated than yours. We are on a sports station. We have a lot of sports fans listening, and one thing we've been wondering is the resumption of not just as regular a life as we could get, but also sports gatherings where you've got 50, 60, 70,000 people in many cases gathering all at once. I want to ask you to look into the future, which is unfair to you. Based on the conversation we just had about a vaccine, do you see anytime soon us being able to A, re-enter the community without starting the curve all over again, and then B, we're talking about like for NFL football, for example, in the fall, what could possibly change between now and then without a vaccine that would not create this issue all over again? Do you think we're looking at longer than maybe we're hoping to look at here?
Well, I see us going through, one can describe 3 phases with this particular pandemic. So you want to consider this phase 1, which is that the virus is spreading and we don't have either a treatment or a vaccine, and basically our main tool is physical distancing. All the things we talked about, right? Staying away from each other, trying to slow the spread of this disease. And we have a lockdown, right? Basically stay-at-home orders, which has been very disruptive but necessary to prevent large numbers of deaths. Once we get past sort of the hump on this, the thing we need to do is greatly ramp up testing. So in many ways, some of the Asian countries, when you look at what's happened in South Korea and Taiwan and Singapore, what you need to be able to do is identify who has the infection, including people who may be asymptomatic, who has recovered from the infection and hopefully is no longer vulnerable anymore, so people who are immune because they've already had the infection, and then people who still may be vulnerable because they don't have any defenses. So if we are able to do mass testing frequently, because obviously someone who doesn't have the disease could catch the disease later, right? Then we could take a more targeted approach where, yes, you do have to isolate the people who have the disease, and they have to be quarantined at home, and that may still be a substantial portion of our population, but we're not talking about everybody, right? And so at that point, you might be able to lift some of the restrictions. For example, in Taiwan, kids are going to school, right? So maybe the kids can go back to school. We are able to go back and eat at restaurants. I don't know whether at that point we'd feel comfortable enough about having a stadium full of people, fans that are shoulder to shoulder. I don't know if maybe at that point, if you can prove you're negative and you're immune, that we'll let you sit in the stadium every other seat. Who knows? So we'll see. But the end game, this is the third phase, is either we have a effective treatment, which will prevent people from getting sick and dying in our hospitals, or we have a vaccine that can prevent this illness. And then after that, if we have those, then perhaps we can get back to what we were used to before this pandemic happened. So those, I think, are the three main stages that I would see. That's why I've focused so much on saying that we need to ramp up our testing capacity, because that will allow us to eventually get to that second phase where we can maybe pursue a little more of a containment strategy than just broad mitigation. But we still need to get through the hump that we're going through now. When I say the hump, we talk about flattening the curve. We're in the upward part of that curve, hopefully with all the stuff that we have been doing here in Sacramento. And I'm very proud of the people in the Sacramento region because, for most part, people are doing what they need to do, and our hospitals are still doing okay right now. They're not overrun like they are in New York City, but things are going to get worse over the next couple of weeks. We're going to see numbers go up, and but I think some of us are hopeful and cautiously optimistic that we're going to keep doing what we've been doing, and that's going to keep our hospitals from being overrun, and we're going to be able to take care of all the people who need care. So, cross our fingers, but we need to keep doing what we're doing. Don't let the disease start picking up even more, and we can get through that, and then hopefully we can figure out a strategy to get to the next phase.
Dr. Pan, we have less than a minute here, so I just want a quick follow-up on that. Are you fairly confident then if someone has had it and has beaten it that they are immune?
We think so. I said yes. We think so. Not absolutely sure. People are still figuring that out, but the evidence is leaning toward they probably are immune. We just don't. Also, we don't know how long they're immune.
Gotcha.
So that's the other thing we have to figure out.
Well, we really appreciate it. We get tremendous feedback. I know Dave and I appreciate this, and thank you. We look forward to talking to you on Friday. We hope you're safe and healthy, along with everyone else out there. Thank you so much, Dr. Pan. We'll talk to you next Friday.
Okay. Thank you. All right.